a room like this, you might be thinking, how did this happen or what went wrong? The fact is, mental health problems affect 1 in every 5 young people at any given time. So remember, you're not alone and we're here to help you and your child throughout this difficult time. The purpose of this video is to explain the process of providing appropriate mental health treatment in an emergency room setting. By having a better understanding of what to expect in this process, you can reassure your child and offer them comfort and support. There are no general hospitals in this area with psychiatric units for children and youth under 18. Your child will be held in the emergency department with other patients until they're evaluated. But it's very important to remember throughout this process that staff and doctors in the emergency room must respond to patients' medical conditions first. There may be a wait to see the emergency room doctor as patients are seen according to how serious their needs are, so everyone's wait time will vary. Several different situations may result in your child going to an emergency room for a mental health evaluation. Your child may be expressing suicidal thoughts or behaviors, and you transport your child to an emergency room. Your child's counselor, psychiatrist, or primary care doctor may ask you to transport your child to an emergency room. 911 may have been called and police respond because your child is exhibiting unsafe behavior. In some situations, you will sign in your child at the registration desk in the emergency department and may need to wait in the waiting room. We understand the urgency of your situation and will assist you as soon as possible. A triage nurse will interview you and your child, asking questions about your child's medical history, presenting problems, allergies, and current medications. Parents are required to remain with their child. You may need to make a few phone calls to arrange for child care or to notify work. The nurse will apply an identification bracelet. When your child is assigned a room, they will be asked to change into a hospital gown. All of your child's belongings will be collected, documented, and stored in a separate locked room. This may be upsetting to your child, but it's important to remember that this is standard procedure and it's important to keep your child safe. A part of the evaluation process is to assess your child's health. In most cases, your child will have blood drawn and be asked to provide a urine sample. Other tests may be conducted to make sure your child is in good health and to ensure that there is no physical or medical cause for your child's emotional or behavioral symptoms. We understand that this may cause some distress to your child, but we will do our best to comfort and reassure them throughout this process. To assess your child's mental health, they may be evaluated by a registered nurse, a licensed social worker, or a medical doctor. These professionals may ask to speak with you and your child privately. To complete the mental health evaluation, we may ask you and your child some questions that may be upsetting or uncomfortable to talk about. It's important to be honest so that your child will receive the appropriate care. Upon completing the mental health evaluation, the emergency room doctor will determine if your child needs to be hospitalized for inpatient psychiatric care or can be treated at an outpatient mental health agency. Remember, the decision to transfer your child to a hospital with an inpatient psychiatric unit for children is not made lightly. It is made with the best interest of your child in mind in response to a very serious situation. The emergency room doctor makes a decision, perhaps with assistance from your child's current mental health provider, about whether your child would benefit from an inpatient hospitalization to help them manage their behavior and emotions. It may be difficult to contain your emotions about your child being admitted to an inpatient psychiatric hospital. But remember, your child will look to you for guidance, support, and reassurance. If the doctor decides outpatient mental health treatment, the nurse or social worker will assist with connecting your child with follow-up services in the community. This may mean your child will be referred to a mental health clinic, private counselor, or psychiatrist. Other referrals may be made depending on the needs of your child. You and your child will be involved in developing a safe discharge plan to address the mental health needs of your child. If the doctor decides inpatient psychiatric care, the nurse or social worker will assist you in the admission process. The nurse or social worker will contact the inpatient psychiatric facilities to see if a bed is available based on your child's gender, age, and presenting symptoms. This process may take some time, and your child may have to spend the night in the emergency room. We understand that this may be upsetting for your child, but we will do our best to comfort and reassure them. Once an inpatient psychiatric facility accepts your child for admission, you may be required to accompany your child to the admission interview at the accepting facility. We will do our best to assist you in complying with the facility's policies and procedures. It's important to have insurance cards, social security number, and other helpful information regarding your child's current psychiatrist or doctor who prescribes their medication. Your child will need clothing and personal hygiene products for their stay at the facility. It would be best if a family member could bring you those items. Once the admission process is completed in the emergency department, the nurse will arrange for transportation by ambulance for your child. All children are required to be transported to the facility by ambulance. Inpatient facilities are required by law to comply with confidentiality policies. No one should be notified about your child's admission or psychiatric treatment without your written consent. With your signed consent, the facility will be in touch with your child's school to continue their education. Certified teachers will assist your child in continuing their educational goals. If your child is on medication upon arrival, they may continue to take this medication. Your child will be evaluated by a psychiatrist to monitor and continually evaluate their medication needs. The psychiatrist may recommend your child to take medication as a part of their mental health treatment. This process can be difficult for you and your child. It's important that you receive the support that you need throughout this process. This is a lot of information to take in, which can be very overwhelming, but remember, you're not alone, and we're here to help you and answer any of the questions you might have.